Welcome to the 3Ds of Advanced Care Planning, how to decide, discuss, and document your end-of-life wishes. My name is Garrick Colwell. I'm an advanced care planning educator and co-founder of Kitchen Table Conversations, a nonprofit organization that was created by myself and my late wife Kinsloe, along with 20 other healthcare professionals, for the purpose of educating people on how to complete their advanced care directives. Today, in this video, we're going to be talking about advanced care planning, what it is, and why it's important to you, your loved ones, and your healthcare professionals. Let's take a moment, take a deep breath, and just imagine we're at the kitchen table, about to have a conversation. I want to make sure you find a comfortable position in the chair you're in. Make sure you have the beverage of your choice. Perhaps have some paper and pen handy for taking notes. And if you would, please pause this video at this moment and download the companion document that you'll find for this video located on the same page where you found this video. That way you'll be able to take notes, follow along, and also make sure that you capture any questions you may have. Welcome back. So again, we're still at the kitchen table. I want to take a moment just to center yourself. Bring your attention to this present moment. Remember to breathe. And make sure that you pause the video at any time you have a question to be sure that you capture that question on your notes. And keep in mind, take your time. This is a lot of information, perhaps new information for you and your family, your loved ones. So take your time. Be good to yourself. Okay, so let's begin. End-of-life conversations are oftentimes challenging to have, but nonetheless, they're important ones to have. And I'm going to invite Ellen Goodman, the creator of the Conversation Project, to give us a little insight into our thoughts about end-of-life conversations, our thoughts about talking to our loved ones, and our thoughts about how we feel about talking with our doctors about our end-of-life wishes.
The Conversation Project is dedicated to helping you and your family talk about your wishes for end-of-life care. Sharing your wishes can bring you closer to the people you love. It's really important, and you can do it. Need a little push to get you started? Consider some facts. According to a national survey we conducted at the Conversation Project, 92% of Americans say it's important to talk with their loved ones about their wishes for end-of-life care. But only 32% have had such a conversation. Turns out, what we say isn't always what we do. And when it comes to having the conversation with our doctors, the gap is even bigger. 80% say they want to talk with doctors about their wishes for end-of-life care, but only 18% report having had this conversation with their doctor. So, what's holding us back? 21% of Americans say they haven't had the conversation because they don't want to upset their loved ones. Well, get this. More than half say they'd be relieved if a loved one started the conversation, and nearly all Americans say they would be willing or want to talk about their wishes for end-of-life care. Have you had the conversation? Our Conversation Starter Kit has helped hundreds of thousands of people talk. Download it for free on the Conversation Project website and get started.
We'll be referring to the Conversation Starter Kit that Ellen spoke about in the video in subsequent videos that you'll see in this series. So you'll be able to download that and be able to actually use it as a workbook to kind of walk you through the process of part of this advanced care planning. But before we do that, let's talk about what advanced care planning is. So advanced care planning is a process And that's important to know. It's a process. It takes time. It's not just one and done. It's not just a task on your checklist, but it's a process because it involves you really understanding what it is that you want and also being able to learn how to communicate what your wishes are to your loved ones and also to your medical professionals. So it's a process that supports adults at any age. Any age is at the age of 18 in the state of Texas and many other states. So at the age of 18 or when in that state a person is determined to become an adult. So at any age or stage of health and understanding and sharing their personal values, life goals, and preferences regarding future medical care. The goal of advanced care planning is to help ensure that people receive medical care that is consistent with their values, their goals, and their preferences. Now, advanced care planning requires communication between patients, their loved ones, and their healthcare providers. Advanced care planning is best done with the consideration of the patient's relationships and culture, which will then drive specific medical treatment decisions that can be recorded in an advanced directive, which we'll talk about in just a moment. What is an advanced directive? Advanced care planning helps patients prepare for current and future decisions about their medical treatment and also place of care. Advanced care planning is a continual process where a patient's current condition and prognosis are reviewed. His or her preferences for information regarding his or her illnesses are elicited and likely medical dilemmas are presented and options are discussed. So let's take a look at advanced care planning from Michael and Liz's point of view and also some input we're going to receive in this video from the Elizabeth Hospice. This is what advanced care planning looks like from a person who is ill and what their point of view is and how it can help navigate their end-of-life journey.
I'll start when we were children. Liz and I have known each other since we were kids, and we kind of got together 30 years later. I was diagnosed about 8 years ago with prostate cancer that was spread to the bone, which is stage 4. It was important for me to plan ahead with the advanced directive because I didn't want to burden family members, of course, for me and also my wife. I don't want to burden her with too much.
When Michael and I were first, our early part of our relationship, he really wanted to be pretty transparent and let me know what had been going on and what his medical condition was. And being a nurse, he thought, well, it might be helpful to me to kind of understand. I'm not directing things, it's really about his choice, his wishes, what he wants to do or not wants to do, and when he wants to do that.
Advanced care planning is a gift that we can give to our families to let them know what we would like should we become ill, terminally ill, or disabled to the point where we are not able to express our desires.
Don't make it an end-of-life conversation. I don't want to shy away from that. The end-of-life conversation is an important one, but make it a conversation about wishes. And it should be intergenerational. It should be children having conversations with their parents and grandparents and vice versa. I want to have a conversation about what my wishes are and what your wishes are. Maybe we can just share that with each other.
It can be a natural conversation that people start with their loved ones, just saying, by the way, I've been reading about advanced care planning and I want to give you a gift. This is my gift to you. So somebody in the family needs to start the conversation, and then it can go from there.
There are a variety of elements of advanced directives, and part of it depends on the state that you live in. There are healthcare proxies, there are power of attorneys, there are other forms that exist at a state level. But the important thing to know is what the different forms do in your state. A good resource for this is caringinfo.org, which is a place where folks can go to and search by state to determine what forms exist in their state and what the forms do. If folks don't have an advanced planning document already executed and something happens, it's often too late to execute it. They may lose capacity, they may lose the ability to make a decision themselves. So that also includes the ability to enter into one of these advanced care documents.
Having those conversations before a crisis occurs or before decisions are needed is really a gift for a whole family. It doesn't matter who starts the conversation. It's a gift that removes the burden of uncertainty for some members of a family and then puts a clearer line of responsibility for those who are the decision makers.
So let's take a look at why advanced care planning is important, not only to you, but your loved ones and your healthcare professionals. Advanced care planning helps ensure that the patient receives the care that is consistent with their preferences. The aim is to provide guidance to the family and reduce their decisional burden about whether they are following these preferences. It also unburdens the family from having to be uncertain about what to do. It gives them clear guidance as to how they're to make decisions in relationship to what your preferences are. Advanced care planning also lays out the groundwork for surrogates, loved ones, or healthcare agents or proxy. In the state of Texas, they're called healthcare agents, which we'll talk about more in subsequent videos, by providing a framework that they may utilize to inform decision-making, keeping in mind the patient's goals, values, and beliefs, as well as their treatment preferences. Advanced care planning also reduces the moral distress among healthcare providers. That's important as well. So once we've done advanced care planning, what we want to take a look now at the benefits of, actually, it brings you closer to the people you love. It prevents painful, unwanted, and potentially ineffective interventions in regards to treatments. It improves the quality of care that you'll receive and decreases the decisional conflict within the family and with healthcare professionals. And that's important. That uncertainty, that conflict can be reduced or perhaps even eliminated by having your advanced care plan in place. It also increases the likelihood that your preferences and end-of-life decisions, of course, will be honored. In order for advanced care planning to have meaning and value, we need to capture what your preferences, your wishes, your goals, your objectives are in advanced directives. And in each state, these advanced directives are different. But the bottom line is that they're a place where you record what it is your wishes and your preferences are, as well as where you also determine and choose who your healthcare agent, your healthcare proxy, the person who's going to decide for you if you can't decide for yourself because you're not able to make your own decisions at a particular time. And so let's take a look at advanced directives, what they are and how to use them. So advanced directives, these are documents a person completes while still in possession of decisional capacity, which means simply that you can make your own decisions. You're conscious and able to make your own decisions about the treatment that you should be made on their behalf, treatment decisions, in the event he or she loses the capacity to make such decisions. So that's important. They're legal tools directing treatment, decision-making, and/or appoint a surrogate or decision-maker, in this case, a healthcare agent or healthcare proxy. It's important to remember that advanced directives are only acted upon when the patient has lost the ability to make decisions for him or herself. It's also important to remember that advanced directives can be revoked orally or in writing by the patient at any time, so long as he or she has maintained decisional capacity. So even though it's on paper, if at a particular moment in time that you want to make a change, you can. Keep in mind, you're making these decisions, you're writing this advanced directive from this point of view and this point in time. Once you get into a place where there's other decisions to be made, you may change your mind. And of course, the provision is that you can change your mind at any point in time and verbally change your directives and change who your healthcare agent is going to be. So let's take a look at what happens when the never event takes place and how to avoid that. Because oftentimes if we don't communicate well, we run the risk of our preferences not being honored and respected. And I invite Dr. Wood to talk to us about what that looks like when wishes are not respected at the end of life, and communication between the surrogate or the healthcare agent breaks down with between them and the healthcare professionals.
My dad was born 30 years to the day before me. Probably one of the reasons why I'm David Peter Wood Jr. Right around my age, we went out to dinner, and he said, Dave, you have some papers to sign here. These are power of attorney. This is my advanced directive, all this kind of stuff. I go, what's going on? And he said, I just want to get this done. You're the only doctor in the family. And, I just want to, make it clear to you that you have this responsibility. So he said, just promise me that I won't wind up in some nursing home watching daytime TV, getting fed by a tube. I guess about 15 years later, I get a phone call from a hospital in Cape Cod. And they said, your dad is in 4-point restraints, out of his mind. Long story short, after about a month, a stroke, pulmonary embolism, he gets diagnosed with West Nile virus, encephalopathy, whole 9 yards. I see him every single day. And then I go visit him in the rehab center, and there he is, sitting in a wheelchair, strapped in, getting fed by a peg, watching daytime TV. Now, did anybody along the way ask me, what did your dad want? No. But did I verbalize it? No. It's this cascade. You don't realize until you're on the other side how this slope goes, and yeah, he'll get better, all this kind of stuff. About a week later, I get a phone call. It said, we just took your dad to the local hospital emergency room. Oh, no. I said, do not reset. And he goes, nope, our policy is, if they get a fever over X, we take them to the emergency room. I go, but I signed these papers. No, in the fine print, it says that we have the right to be able to transfer that person. So it's about midnight. I get a phone call. Your dad's in the ICU and he's not doing well. I go, wait a minute. This is do not resuscitate. He goes, oh, that was at the nursing home, I guess, but you didn't do it here at the hospital. I said, I'm not going to let this happen again. So I put on my clothes, put on a pair of scrubs, and I just walked right into the ICU. The monitor says my dad's blood pressure is 80/40, heart rate of 150, Jeez. And they're jabbing him in his groin because they can't get IV access. Poke marks everywhere. I go, stop. And they go, who are you? I go, I'm his son. They go, well, we can't stop. We don't, he's in the ICU. I go, stop right now. Give me your attending. Oh, the attending's not here. Just the residents. I go, get the attending in here. And I want you to stop right now. They go, well, we're going to have to call security. I go call security. Go ahead. So isolated, right? Nobody supporting me, trying to do what I know my dad wanted me to do. And I did it. I was able to get into bed with him, and he died. But I reflect back on how much better that experience could have been for me and for him if someone would have said to me, what does he want? What do you want? What are your issues? What are your concerns? What is the never event that you want to happen? Because I would have told them, I don't want him going to the ICU. If we could develop a culture where it wasn't, checking the box and filling out Epic, but instead saying, what does the patient want? What does the family want? I think that experience, which was horrible, as you can see, to this day, right? This is years later, could have been a pleasant, tragic, but a better event.
So, a sobering video showing us that the importance of advanced care planning, advanced directives, having your paperwork in order, but most importantly of all, making sure that what your wishes are communicated clearly and proactively when it comes to your health care. So let's take a look at a recap here of what the purpose of advanced care planning is to understand your values, your goals, and your priorities. This is where you take time to reflect upon what's most important to you and start understanding how it is you might answer that question. What is most important to me? The goal is to enhance your quality of life. So even though we're talking about your end of life, we're not talking about the end of life in a morbid way. We're talking about it to ensure that we understand what it is that you want, and so that you're able to communicate that and also live exactly the way you want up until your last breath. And so this is intended to help you enhance your quality of life through the end of your life, making sure that we're coordinating your care in alignment with your goals, your values, and your priorities. And again, the benefits here are staggering. They're just so important. Many benefits. It brings you closer to the people you love. Again, it prevents painful, unwanted, and potentially ineffective interventions. It improves the quality of your care. It decreases the decisional conflict within your family and your healthcare professionals. Now, this is important for your family from this point of view, is that if in fact you were not communicating or not telling them what it is your end of life wishes were, and you left those decisions to them at the time those decisions, difficult decisions may need to be made, and they make those decisions, they are oftentimes forever haunted by the idea that they may have not made the right decision. Did I make the right decision? Is that really what she wanted? Is that really what they wanted? Is that really what he felt was the right thing for me to do? And so it complicates the grief after the death. And so you unburden them from having to deal with the grief and the shame afterwards, which makes grief very complicated. I mean, they're in pain already through the loss of their loved one. Now they're compounding that pain and that sense of that feeling of loss with guilt and shame. And you can relieve them of that, unburden them of that with that by making sure that your advanced directives are in order and that they're clearly communicated in these conversations of end of life take place with your loved ones as well as your healthcare professionals. And the final benefit here that we want to talk about for advanced care planning is that it increases the likelihood that your preferences and end-of-life decisions will be honored. In other words, if you don't tell your family and your healthcare professionals what your preferences are, those decisions will be made for you. So, when is the right time to get your advanced care plan in order? Today. Because remember, it's always too soon until it's too late. Thank you for taking the time to watch this video. If you have questions of any type along the way as you go through your advanced care planning process, please feel free to reach out to me at this email address or give me a call. And in the meantime, we have in-depth webinars, which the schedules are posted on our website, and there are many additional resources that you may want to take advantage of by going to our website and seeing what it is that you might want more information about. So once again, thank you so much for taking the time to watch this video.